No. We're not just going to make stuff up. We're not going to do that. The United States spends more on healthcare than any other industrialized nation, and we rank 37th in quality and access to care. We are not the best. We are 37th. The 36 above us all have some form of socialized medicine or universal healthcare, and they spend less on healthcare as a society than we do. The reason is healthcare in those nations is a regulated market. I used to work in healthcare, and my boss was the CEO of a healthcare system. He used to half-heartedly joke about the fact that even he didn't know the price of the surgeries in his hospital. Doctors don't know what they're charging. The hospitals don't know what they're charging. The billing agents at the hospitals don't know what they're charging. The only people that know how much these services cost are shadowy little figures at the for-profit health insurance companies. They just make shit up using actuaries and risk factors and age and bullshit. And then they use every technique that they can possibly think of to deny your coverage at every possible point. How come you pay for health insurance but still get a bill? Sometimes you get a massive bill. Sometimes people have huge deductibles. They have to end up paying for most of their hospital stays, even though they have prepaid insurance. And don't tell me that our system is preferable because it means you don't have to pay for other people's care. People who say that don't understand how insurance works. When you pay an insurance premium, your money goes into a big pot of money with everyone else's money. And then when somebody gives birth or has a surgery or needs chemo, the insurance company takes money out of that pot of money to pay for it. You are not exclusively paying for your care when you pay your insurance premium. Your money is paying for any other possible person that might get paid out of that pot of money. The only difference between that system and the universal healthcare systems is that you're also paying the CEO's salary. You're paying the shadowy agents who are trying to scam you. Obamacare was the first law in place that said that insurance companies had to spend a certain percentage on patient care. They needed a law in place to tell them they had to spend more on patient care than CEO salaries. And these are the people you want to put your medical faith in. And you're worried about a public system making you wait for care? The entire private insurance system is designed to deny you care. That's their profit model. Now take the single payer system that they have in Canada. Every citizen pays taxes into a medical plan, a public medical plan, that then covers all of their medical expenses. Anytime they go to the hospital, they don't get a fucking bill. It's already been paid for. This is generally what Bernie wanted to do with Medicare for all. And yes, it will increase taxes slightly. But you're telling me right now you wouldn't be willing to pay a little bit more in taxes if it meant you never got a hospital bill ever again? And I want you to think really hard before answering that statement. And if you think I'm so wrong, why do 36 other industrialized nations do it and do it better than us with socialized healthcare? And yet their economies are just fine.